Thanks for getting in touch with me and giving me an opportunity to share a little bit about COVID-19 in Okanogan County with everyone. I'm glad that we're on the other side of our wintertime surge and aren't seeing as many cases as we were in November and December and early January of this year. And hope that we can stay down in a lower incidence level. But have seen over the past couple of weeks that we're going up and down. And we're still seeing some spikes in cases all over the county with folks traveling, folks not adhering to the community spread measures that we've requested people to adhere to. And so we do see a couple of days a week increased cases. Our incidence rate is right around 140 new cases per 100,000 people in 14 days. And we'd really like to get that down below 100 and down below 70 ideally, which is the level at which we've said in the past, we'd like to see schools reopen, schools get back into full-time classes and move towards our businesses reopening. We'd like to get down below 100 and stay below 100 so that we can stay in phase 3 of the governor's reopening process. We're headed in the right direction. At this point in time, people know what to do and people are doing a really good job at protecting themselves, protecting their families, protecting their community. And we just ask that people keep up the good work, keep masking, keep social distancing, avoiding unnecessary travel and large gatherings. I've been really impressed at the way Okanogan County has come together. All of our community partners are now vaccinating, and we're setting a standard for the rest of the state and have been recognized as one of the most successful counties in getting a large number of our population vaccinated. We're close to 30% now of individuals being vaccinated, and we're shooting to get up to somewhere between 60 and 80% of individuals being vaccinated to reach that peak of herd immunity where the vaccination alone will protect us from further community spread. Now, we don't have to wait until we get to that level to actually see the impact. And in fact, among a lot of our populations who have been vaccinated and were vaccinated early in the process, we're seeing decreases in cases. So among our elderly population and our populations that have a little bit higher degree of vulnerability, as large number of those individuals get vaccinated, we're seeing fewer cases within that age group or those demographic groups. And so we know that vaccination is having an impact. It's keeping some of the most vulnerable members of our community safe. And we'd like to see that spread and extended to everybody in the community. And so as we open up the subsequent phases and are able to vaccinate more people and get more supply of vaccine, we're still encouraging everybody that's eligible to get vaccinated because it's really one of the strongest strategies that we have. In just another week on April 15th, we're going to be vaccinating everyone who's 16 years of age and older. And so really it's become open season for adults, and everyone who wants the vaccine can register and receive the vaccine. We're working through our lists of people who are eligible and desire the vaccine pretty quickly. And we're hoping that we'll continue to see a large supply from state and federal sources so that we can get as many people vaccinated as possible. It's enabling a lot of people to travel. It's enabling people to avoid quarantine if they know that they've been exposed. And it's helping keep people safe and healthy. We've seen very few cases of breakthrough, meaning people have become ill after receiving the vaccine. There are only a little over 100 cases and over 1 million people in the state that have been vaccinated. So very, very small numbers of people actually getting sick after they've been vaccinated. There have been some people who have gotten COVID after their first dose of vaccine. We know that 2 weeks after the first dose of vaccine, you're about 50% protected, so you're not completely safe, which is why we really strongly encourage folks to get their second dose. We're recommending as well that people who have had COVID in the past, go ahead and get vaccinated. Natural immunity, we know, lasts for about 3 months. But after that, we're not certain how long you're protected from the COVID virus itself or the immune response that your body has. So we're recommending that if you've had COVID, go ahead and get vaccinated, and you really only have to wait for 10 days while you isolate to protect other people from being contagious to go ahead and get the vaccine. So I've had patients that have gotten COVID, and 2 weeks, 3 weeks, 4 weeks later, I've gone ahead and given them the vaccine so that they can be assured that they won't get it again, that they won't spread it to other people, and they can be more assured that they're safe for a longer period of time than the natural immunity has provided to them. There's been a small trial that Pfizer has run looking at kids ages 12 to 16 years of age. And it looks like the vaccine is just as effective in those age groups and doesn't carry any other side effects or any adverse consequences of vaccinating kids from 12 to 16 years of age. So Pfizer has appealed to the FDA to receive an emergency use authorization, and I believe that'll come through pretty soon, and we'll be able to begin extending the Pfizer vaccine to kids 12 years of age and older. It'll have a big impact on the safety and security in our schools, as well as travel and camps and other activities that kids are going to enjoy in the summertime and in the coming school year. We're still recommending that anyone who develops symptoms of COVID, if you have a fever, cough, loss of sense of taste or smell, if you have unexplained nausea, vomiting, fever, chills, muscle pains, joint pains, headaches, those are all symptoms of COVID. And if you have any of those symptoms at all, we'd love for you to get tested. Know that you don't have COVID, so we know how safe our community is. Keep up the good work, Okanogan County. There is a light at the end of the tunnel. We're working towards that. We need people to remain vigilant, continue to make smart decisions, and we'll get there. We'll get there to a point where our schools are all fully opened, businesses are back operating normally, and we can put this pandemic behind us.